Hi, I'm Suzanne Robotti, the founder of MedShadow, and our content editor is Jonathan Block. We're here today to talk to you about informed consent in children. If you're at the doctor's office and your doctor is prescribing antibiotics for your 9-year-old, do you ask your 9-year-old for his or her opinion? Do you ask a 7-year-old if they want a shot? I don't know, but the American Academy of Pediatrics is suggesting that yes, the child should have a role in informed consent. Informed consent has a long history and a proud history. It's a recognition by the Medical Association that the patient has a right and even a responsibility to understand what medical procedure or medical care they are about to receive. And if the patient doesn't want that care for any reason at all, that is a patient's decision, not the doctor's. Children are different. Should they have a voice, Jonathan?
I think that they should have a voice, but as far as the size of that voice, I think depends on a couple of situations. One is the age of the child. A lot of times you might get a 7-year-old, if you were, as what you said, if they want to get a shot, they'll say no because it might hurt, but the benefits of getting a shot are obviously much better for the child. Where I could see informed consent coming into view, and I would support it, would be for adolescents or children that have gone through their lives, if they've had major medical issues. They are more mature. They have a better understanding of what's going on with them, and I think that when you're of a certain age, maybe 12, 13, I think at that point you understand the benefits and risks of a certain medical procedure or a medication, and that you should take a 12 or 13-year-old's desires and opinions when making medical decisions.
Well, the American Academy of Pediatrics came out with a statement that says children as young as 7 should have an opinion on their medical care in certain conditions. And my examples earlier were clearly exaggerated. The American Academy of Pediatrics was not suggesting that a 7-year-old be able to resist taking a tetanus shot. That's really not a decision that they should get a thumbs up or thumbs down voice on. But it did give, as an example, medicine for ADHD. And it quoted a study that showed when parents and children were told together about the risks and benefits of ADHD medicine, the children showed as much comprehension as the parents in a quiz a few minutes later. I'm going to be a wise guy here and say that kid probably doesn't need ADHD medicine in that case, but I'm being a wise guy. And in that was an example where the AAP said, yes, the child should have a very significant vote there. Again, does that make sense to you?
Yes, I think that in the situation that you just described, it is important to get at least input from the child. Just because a kid is 7 years old doesn't mean that they're completely absent from the conversation on their medical treatment. I think it's important to have kids be informed as much as they can understand given their age. And I think it is important for them to understand, even at a young age, why the treatment is being given. And it also could have a longer effect in that if you started out with them understanding why certain medical decisions are made in an early age, it'll likely make them more likely to be better informed as they get older about health.
Certainly they should understand the ins and the outs of it all. There are a couple of cases where the medical community, and in most cases the law, agrees that the child can make decisions without any input from parents, with the parents not even knowing. And that, generally speaking, is healthcare that has to do with sexual activity. Anything having to do with contraception, sexually transmitted diseases, pregnancy. In most cases, the medical community says you can deal directly with the child without any parental involvement. And also in the case of mental illness or in substance abuse, the child definitely gets a say there.
Well, I think it's something that's also important to note that the American Association of pediatricians said is that doctors themselves also play a role. Obviously, if a kid is old enough and they say they don't want a particular treatment, that doesn't mean that the physician just gives up there. It's actually responsibility of the physician, both morally and legally, to say, look, this is the best course of action. This is going to be important for your long-term health. But of course, that creates other difficulties, because the reason why the child may be objecting is because of religious or other kinds of reasons. But the point is that doctors still have a role to play in advising children and their guardians or parents as to what the best course of action is.
So our advice is read beyond the headlines, because many headlines are saying 7-year-olds now get decisions on medical care. And look carefully. It's up to the doctor and the parent to involve the child so that they understand their medical care and at the appropriate time can take complete adult care of themselves. So work with your doctor, work with your child, and please read MedShadow at medshadow.org.